You wake up every morning wondering what more you could possibly do to protect yourself from cancer after 60. What if the single most powerful step you could take had nothing to do with expensive medications, complicated treatments, or any of the things your doctor has already discussed with you? What if it was something so deceptively simple that most people completely overlook it every single day? And what if the science supporting it has been quietly confirmed in medical journals for years, yet rarely explained in a way that actually changes how people live? Stay with me, because in the next several minutes I am going to, share something that has genuinely transformed the way I counsel my patients. And I believe it can change the way you think about your own health forever. My name is Dr. Hidden Stories. I have spent my career working with people navigating cancer, from early prevention conversations to the difficult diagnoses no one wants to receive. And over the years, I have asked myself the same question again and again. What could we have done differently? I now have an answer, not a complete answer. Cancer is complex, and no single habit prevents every case. But there is one daily behavior whose relationship with cancer risk is so thoroughly documented, so consistently replicated across so many different cancer types, that I believe every person over 60 deserves to understand it clearly and completely. Most of you have never heard it explained this way. And by the end of this video, you will know not just what the habit is, but exactly why it works at the cellular level, how much of it you actually need, and the one common mistake that quietly cancels out almost all of its benefits. There's one thing I need you to promise me before we begin. Do not click away when I name the habit. Your first reaction will almost certainly be, I already know that, and I am telling you right now. You do not know what I'm about to tell you about it. The research goes far deeper than most people realize. Stay with me. Before I name the habit, I need to explain the biological reality that makes it so important. Without this foundation, the advice sounds like generic wellness talk. With it, it becomes something entirely different. Here is what is happening inside your body right now that most doctors never take the time to explain. Every single day, your body produces cells that contain genetic errors. This is not abnormal. It is normal biology. Your DNA replicates billions of times across your lifetime, and mistakes are inevitable. In a healthy body, three powerful systems work together to catch and eliminate those errors before they become cancer. Your DNA repair enzymes identify and fix mutations. Your immune system, specifically natural killer cells and cytotoxic T lymphocytes, patrols for abnormal cells and destroys them. And a process called apoptosis, or programmed cell death, tells damaged cells to self-destruct before they can multiply. These three systems are your body's built-in cancer defense architecture. After 60, however, all three begin to slow down naturally. DNA repair enzymes become less efficient. Natural killer cell activity declines. The apoptosis mechanism grows less responsive. This is not a disease. It is aging, but it means the margin for error gets smaller. The cells that your body easily eliminated at 40 are now more likely to slip through at 65. And here is where the habit becomes powerful. Research across dozens of studies has shown that one specific daily behavior directly strengthens all three of those defense systems at the same time. It upregulates DNA repair enzymes, boosts natural killer cell activity, and reduces the chronic inflammation that creates the perfect environment for cancer to develop and grow. The habit is consistent, moderate physical activity, not intense exercise, not marathon training, not expensive gym memberships, simply consistent, moderate intensity movement performed most days of the week. Let me tell you about a patient I will call Mr. Ellis. He was 67, a retired accountant, precise and methodical in everything he did. He came to me after a routine colonoscopy, discovered 3 precancerous polyps. Not cancer yet, but cells clearly heading in the wrong direction. His father had died of colorectal cancer. His brother had been treated for prostate cancer years earlier. Mr. Ellis sat across from me, visibly frightened, and asked the question I hear almost every week. What do I do now? I told him about this habit. I explained the research. I gave him a clear, realistic protocol, and asked him to commit to it for 6 months before his next colonoscopy. We will come back to Mr. Ellis because what happened at his follow-up is one of the most meaningful outcomes I have seen in my career. The science is remarkably consistent. A landmark meta-analysis published in the Journal of the National Cancer Institute, looking at data from over 1.4 million adults, found that higher levels of regular leisure time physical activity were associated with a significantly lower risk of 13 different cancer types, including colon, breast, endometrial, kidney, gastric, bladder, and esophageal cancers. The risk reduction ranged from 10% to more than 40% depending on the cancer and activity level. These are not small numbers. Another major analysis in JAMA Internal Medicine showed that adults who met the standard guideline of 150 minutes of moderate intensity activity per week had meaningfully lower cancer mortality rates than sedentary adults. That is 21 minutes per day. A 20-minute brisk walk. Let me repeat that because it needs to land. 20 minutes of brisk walking every day is linked to significantly lower cancer mortality in adults over 60. Now let me show you the 3 precise biological mechanisms that explain why this works so well. Mechanism 1, DNA repair. Moderate physical activity increases both the production and efficiency of the enzymes responsible for repairing DNA damage, the same pathways that fix errors caused by normal cell division, environmental toxins, and oxidative stress. Studies in cancer epidemiology, biomarkers, and prevention have shown that physically active older adults demonstrate significantly higher DNA repair capacity than sedentary people of the same age. Physical activity does not just maintain the system, it actively restores some of the repair capacity that aging has eroded. It also reduces the oxidative stress that creates the damage in the first place by strengthening the body's natural antioxidant defenses. Mechanism 2. Natural killer cell activation. Natural killer cells are your immune system's frontline cancer surveillance team. They patrol the body, recognize abnormal cells, and destroy them before they can multiply. After 60, both the number and killing power of these cells naturally decline, one of the main reasons cancer rates rise with age. Moderate exercise is one of the most potent known stimulants of natural killer cell mobilization. A single 30-minute session can increase circulating NK cells by up to 50% in the following hours. More importantly, regular moderate activity leads to lasting improvements in their function. Chronically active older adults show significantly higher NK cell cytotoxicity than sedentary peers. The immune surveillance system does not just get a temporary boost, it receives a sustained upgrade. Mechanism 3. Reducing chronic inflammation. This may be the most important mechanism of all. Chronic low-grade inflammation creates the exact internal environment in which cancer thrives. Sedentary behavior itself is an independent driver of systemic inflammation. Regular moderate movement lowers key inflammatory markers such as interleukin-6, C-reactive protein, and tumor necrosis factor alpha, while increasing anti-inflammatory cytokines. It also reduces visceral fat, a major source of inflammatory signals. Even when weight loss is minimal, every day you move moderately, you are quietly changing the chemical environment inside your body, making it less hospitable to cancer development. The one critical mistake that undoes most of the benefit is intensity. Many people who decide to get serious about exercise push too hard and too fast. Very high-intensity workouts can create a temporary immunosuppressive window in the hours afterward. For cancer prevention, you want your immune system consistently active, not repeatedly suppressed, and then recovering. The sweet spot is moderate intensity, the pace where you can still hold a conversation but are slightly breathless. Brisk walking, comfortable cycling, swimming, dancing, or gardening at a steady pace. Frequency beats intensity every single time. 5 20-minute moderate walks spread across the week deliver far more protective benefit than 2 exhausting gym sessions. Quick question for you right now. How many days per week are you currently getting at least 20 minutes of moderate physical activity? Be honest and write the number in the comments below. I read every single reply, and the answers consistently show me where the biggest gap exists between intention and action. Mr. Ellis returned for his follow-up colonoscopy 6 months later. He had done nothing else dramatic. No major diet overhaul, no new supplements, just 25 minutes of brisk walking 5 days a week, without fail. His doctor found only 1 remaining polyp, down from 3. The polyp had not progressed, his inflammatory markers had dropped into the normal range, his natural killer cell activity, measured at baseline and again at 6 months, had increased by 34%. Mr. Ellis looked at me across the desk and said something I have quoted to many patients since. I spent 6 months walking, and in those 6 months, I felt better, slept better, and apparently my body started doing its job again. Why did no one tell me this sooner? The research has been accumulating for decades. The mechanisms are well understood. The dose is achievable by almost anyone over 60, and the cost is 0. Yet this information is still too often mentioned only in passing, if at all, during routine oncology visits. That gap is exactly why I make videos like this one. Let me bring everything together clearly and practically. The single habit with the most consistent, most replicated, and most mechanistically understood cancer preventive effect in adults over 60 is consistent, moderate physical activity, specifically 20 to 30 minutes of moderate intensity movement performed 5 or more days per week. It works through 3 powerful pathways: enhanced DNA repair, strengthened natural killer cell surveillance, and sustained reduction of the chronic inflammation that allows cancer to develop and thrive. The critical mistake to avoid is either doing nothing because it sounds too simple, or pushing into high-intensity exercise that repeatedly suppresses the very immune function you are trying to strengthen. Here is what I am asking you to do today, not next month, not when the weather improves, but today. Choose 1 20-minute block in your day and commit it to movement. A brisk walk around the block, a comfortable cycle, 15 minutes of movement followed by 5 minutes of gentle stretching. Something you can repeat tomorrow and the day after. The first day is the hardest. The second is easier. By the end of the first week, the habit begins to form. By the end of the first month, your natural killer cell activity is already measurably higher than when you started. That is not motivation. That is biology. Which part of this changed how you think about cancer prevention? Tell me in the comments below. I read every single one. And if this gave you something you will genuinely use, please share it. There is someone in your life, a parent, a spouse, a friend, who needs this information and does not have it yet. That one share may be one of the most useful things you do for their health today. Subscribe for more honest conversations grounded in what the research actually says. Next time we are going to talk about 5 common foods that research increasingly links to higher cancer risk in adults over 60. And at least 2 of them are foods most people currently believe are healthy. Take care of yourselves. Move today, and remember this. The most powerful cancer-fighting tool you have access to is not in a pharmacy. It is already inside your body, waiting to be activated. You simply have to give it the signal. One final note. Everything shared in this video is based on published oncology research, epidemiological studies, and exercise immunology literature. It is general educational information, not personal medical advice for your individual situation. Cancer risk is complex and involves many factors. If you have concerns about cancer risk, a personal or family history of cancer, or any existing health condition, please have a full conversation with your own physician before making changes to your activity level. They know your complete history. This information is a starting point for that conversation, not a replacement for it. This is Dr. Hidden Stories. Stay informed, stay active. and I will see you in the next one.